Well, wonderful. This is really a pleasure to be here. Again, my name is Matt Trowbridge. I'm a physician, public health researcher at University of Virginia, and it really is exciting to be here. I am coming late only because this is such the right topic of conversation that there is a similar conversation happening at the National Institutes of Health today. And I was actually, because of my work with the U.S. Green Building Council, we were co-hosting that, and so I apologize for only being able to join now, but I promise you this is an important conversation, so thank you for having me. And being part of this session is perfect because that's really the idea of scaling up and how do we bring this to scale? How do we create infrastructure where innovation can make it to market in a meaningful way and really start having a population level impact is really becoming more and more the center of my career and the work I'm most passionate about. I think we all have a role to play in this movement, and I'm exploring this one, so I'll show you what I'm up to. And I'm positive I'm preaching to the choir, but why don't we just sing it again here? Basically, what I try to do when I talk to folks is try to give you a sense of where I'm coming from when I enter into this conversation. And I was, trained as a physician. I am a pediatrician, also a preventive medicine physician, and I have a master's in public health. And I would, like everyone, was trained in the core ideas of environmental health in the old school manner. Everybody here knows that this is John Snow's, water pump in downtown London. But what I want to utilize it is this has been our prevailing idea of what environmental health is for a while. The physician sits in their office, they see a patient come in with a constellation of symptoms, and then think maybe there's an environmental toxin, and goes out, finds the toxin, and removes it. Similarly, we've been doing it with things like lead paint. Again, waiting in our offices, seeing constellation of symptoms, going out, finding something, removing. I think what we're all aware of, though, is that now we're realizing that the environmental toxins are really different. They're not as amenable to that model. And we're also starting to try to figure out how do we get out and change things proactively. This is a classic slide that I think all of you guys probably use in your own slide decks. But I mean, what I'm trying to utilize it here for is, I'm sure, yes, we're talking about communities, we're talking about city scale, but we're also, you can come down in scale all the way down to building scales, little moments of design in our day-to-day lives that add up to really big impacts, all the way down to, obviously, even things like interior design at this point. And I use this slide just because I always love it when a non-traditional public health publication gets in on the action. But I think that the Harvard Business Review is reflecting a growing general population interest and belief that this is important. And we have to harness that, obviously, right? Everybody in this room understands that. Again, the idea. So how do we respond as people are asking for action, asking to move forward? And I really do genuinely think we are at a profound moment of opportunity. I'm sure folks have been talking about things like the active design guidelines and things today. We're starting to see these really interesting experiments like the radical but fascinating changes and experiments in New York through like transforming roads like Broadway. I guess what I wanted to kind of highlight and stand back from things like the active design guidelines to say is, what I see in them and what has been so inspiring to me is that these are actually tools. Someone has taken the time to bring together public health practitioners with designers who are thinking about how to make real tools for market. And the active design guidelines are what's really important about them is when you open them up and go through them with an architect, they look like something they know how to use. They're actually actionable, and that has led to them being much more adopted. I think that's part of why they've really caught on, and we need to do more of this. What's also exciting, the other reason it's a moment of opportunity is that the places are we're all starting to be able to experience what very different built environments might be like. Obviously in high profile places like New York. I always bring up the High Line because one of the things I love about the High Line is not just that it exists, which is amazing, but also that if you walk along it, it celebrates every moment of it is highly designed and unique. You know, this was not just a utilitarian park. I mean, you know, the landscape architects really got to show what they can do. And I think it's also incumbent on us as we push out this movement that we really highlight the fact that good design is really critical to the success of this. You know, the High Line compels you to walk along the entire thing because you keep getting surprised. It's contextually appropriate. It's exciting. How do we bring that, you know, to scale is an interesting question. I also love it that it's not just in New York. It's not just in I'm sure, you know, I think places like Detroit are having amazing places, but also even places like Nashville, Tennessee. I went there recently, and they're doing this type of development now, and people are responding. These are real places shot with my iPhone, you know, and people are having an amazing time utilizing these amazing new spaces, and I think the other cool part is that it's not just happening accidentally. This was this group, a ULI, Urban Land Institute, you know, regional meeting that I was asked to come and speak at. And, you know, health is front and center. People are trying to figure out how to do this. The whole event was focused on this. So there's people on the ground turning these places into reality. And again, these are the types of, you know, ideas that are being pushed out all across the United States. One of my favorite stories from Nashville actually was this, a health center. You know, I love this because the guy in the foreground there, he runs the Civic Design Center at Nashville, who has a designery look to him. You know, but the guy in the back, he's the medical officer for Nashville. You know, not a designer-looking guy, and actually accidentally came to active design. He was just charged with creating a health center in Nashville, and somehow stumbled across active design and decided to figure it prominently. So he made these the stairs to celebrate physical activity. I can't help but just tell you guys the full story, which is they're standing up on this cool track thing, because what happened was, as the users of the building got excited about the idea of active design, they started asking for more. And so basically they had done things for daylighting, like they had there weren't any corner offices, so there was almost essentially like a track that went around the outside of the building. But the users came back to the architecture firm and complaining, but you're giving us a semicircle, we need a full track. And the architects basically were like, well, I mean, we could do a cool bridge across the top of the lobby, but we've never thought we'd get approval for that. And because it was now part of the design story to do active design, it passed, and there it exists. And so now there's actually lunchtime walking meetings going on inside of a Nashville health clinic. Super cool. And then, you know, this is now what active design is starting to look like in practice. And the cool part was there was so much success for that it built biking, and they're going to be getting a bike share station out here, which was not originally part of the plan. So my point is, moment of opportunity is these places are starting to happen. There's tools that people can pick up and utilize, and design teams know how to use, but we have to keep making more of that. So this moment of opportunity was actually what inspired some work I did via a interagency personnel agreement with NIH and the National Collaborative on Childhood Obesity Research. It was the idea exactly that. How do we make more of these tools? How do we get more of this evidence into practice? And one of the ideas we came across was, well, who else in this sphere is pretty good at taking concepts like health and making them matter in the market? And I didn't know anything about green building, but I said, the green building industry has been pretty successful at that. Why don't we engage them? And that led to a project I led for NCORE, which was a partnership between NCORE, the U.S. Green Building Council's Center for Green Schools, and the National Academy of Environmental Design. And we convened a workshop and a set of papers, and all focused on merging the kind of market transformation capacity of green building with emerging evidence from public health. And it really, you can obviously, this initiative is still going on from NCORE. If you go to the website and search for Green Health and NCORE, you can find it. There's a whole workshop summary that this is just the title page of that you can download. And the cool part is it's been downloaded over, I think over 500 times now, and is really being utilized across the U.S. But the cool part, and the stuff I'm really going to use the last few minutes I have with you today is just to talk about is what we, there was enough excitement generated by the idea of something, how do we get to scale, and that maybe the green building industry has something to help in terms of help as one potential mechanism. Robert Wood Johnson stepped up and said, hey, we'd like to continue this work, keep expanding this. And so for the last 2 years, I have been funded to work, kind of embed myself in the U.S. Green Building Council and lead what we are calling a Green Health Partnership. Again, very much specifically focused on how do we, looking at what tools available for market transformation in green building, think about how do we get health more intentionally adopted as a focus for that. And it's been focused on basic 3 objectives: put leadership right at the intersection of green building and public health, prototype practical and scalable health metrics based on existing LEED green building system components, and then demonstrate some early integration of these health metrics into the USGBC products and tools. And what we've slowly, after 2 years, I think the key, this slide has taken a long time to get to. Basically what we've realized is what we're really all trying to do here is make healthy places investable. And what I mean by that, because actually that's what the green building industry has done so well. They have made green something that the market can measure and hence can invest in. And I think if we can use that as a frame, we can start getting somewhere with health as well, at least from the perspective of scale up and using some existing partnerships like green building. And so one of the products that I think you guys might find intriguing is, as I said, we decided to take a look at what is available today, like what in LEED is ready to ship in terms of health. Because we also, if you're going to scale, if you're going to start trying to use new tools like the green building apparatus, you absolutely have to know where we are now so that we can decide where we want it to be. So we just did a quick, and when I say we, I always, of course, mean 2 graduate students, read through all of LEED twice, which, as if you guys know, that's a pretty big undertaking. And essentially, does everyone here know U.S. Green Building Council LEED? Can I assume that? Okay, then I will skip over this slide here. I think you guys know that LEED, how it generally works, it has a whole bunch of domains that it tries to address. But basically, our goal was to look at where health is referred to within LEED, how consistent is the health language within LEED, how are health-related strategies currently used. And just for interest sake, the results of this that I'm about to show you were just published in the American Institute of Architects. That is a whole series of papers that came out of that design in health, and so ours also just was released. You can you can just search for it on their website. But here's what basically we found. So one of the key things I've learned as a physician, all excited, running into U.S. Green Building Council saying, don't worry, we're going to do health. And of course, what the green building industry says is, hey, we've been doing health for a long time, or at least it's been a value that we've had for a long time. And that turns out to be true. Basically, what you do find is health-related issues are actually addressed. We found health and wellness-related credits and intents in every LEED credit category. That was certainly true. However, what we did find is, not surprisingly, because there hasn't been a formal, intentional public health frame, is an incredibly wide range of terminology being used currently to describe health-related issues. So this is just literally a word count of things we found. And there are all kinds of words, and the honest truth is, too, as a public health person, they aren't words that I'm used to necessarily utilizing. It's hard for me to know how to plug in. And you can see, again, if you dig down into things like school, the types of words that get used are more like well-being, productivity, comfort, absenteeism, irritation, different words than we're used to using in public health. Another key thing we found was that once you've made LEED, the health credits within LEED machine readable, we were able to hook them up to the database of all LEED certified buildings we have. And basically what we found, then what we did was we took the set of health related credits we had identified and looked to see how were those health credits currently being achieved in LEED certified buildings. And basically what we found is, not surprisingly, there's a slight trend of, if you go towards platinum as opposed to gold, There's a higher number of health-related related credits being utilized, but if you guys know statistics, what's really interesting to me is that these whisker bars suggest that the variance of whether the health-related credits are currently being used is wide open. What does that mean? It means that we have, I think, in my mind, we have a really powerful potential partner for scaling up health, the green building industry. There's some health-related credits currently waiting to be utilized, but currently they're not really being utilized in any sort of directed way. Now, the last thing in the world I want to stand up here and say is that everything that's in LEED now makes a perfect health measure. No. But I think what we do have is a nice vision for how we could use a really powerful new partnership, set of tools, and a group that has a leadership position in the real estate market. So, and they are very excited to engage with us. The last thing I wanted to say too is, again, there's this swell of interest in this. Just last Friday, I was at the National Press Club as part of a release for the current issue of Health Affairs is focused on community development and public health. It was co-sponsored by the Kresge Foundation, Robert Wood Johnson Foundation, and Annie Casey Foundation, I believe. And I really recommend, for this crowd, you guys need to check it out. Like pretty much every article in there will be really relevant to you. The one that I worked on was thinking about kind of proposing some performance criteria for health and wellness metrics that might try to bridge some of the needs of the real estate industry with those of the more of the public health world. And I invite you guys to, as I said, the November issue of Health Affairs. If you go to through the Robert Wood Johnson site, it's all open access at this point. So that's it. I just wanted to give you a snapshot of the things that I'm working on, and I really am excited about this, and we are hoping to continue this work, and we are always seeking new partnerships and people who can help us best utilize these new tools. Thank you very much.
Thank you very much.